The 1700s was a time period where people with mental illness had little to no place in society. They were despised, mocked, and put on display. They wondrously and homelessly walked the streets with no place to call home, and no one to care for them properly until 1751. In 1751, the first hospital in Philadelphia was created for people with mental illness. The Pennsylvania Hospital became the first institution in the country to extend medical services to, quote, lunatics or persons without sound mind, as stated in the 1751 charter. Of the hospital's first 6 patients, 4 were admitted for insanity. Although care was far from enlightened by modern standards, the idea that insanity was a treatable disease was itself revolutionary. Colonial Americans commonly believed insanity to be a demonic affliction brought on by an evil visitation. The insane were seen as incurable, subhuman creatures doomed to a life in shackles and chains at a poorhouse or jail cell for the mad. Pennsylvania Hospital became a primary force in shaping the attitude of colonial Americans towards persons with emotional and psychological dysfunctions. At a time when many medical institutions were designed simply to remove the ill from the community, the Pennsylvania Hospital aimed to restore them to active health, and toward this end it connected from its very beginning medical care and medical teaching. From the 1780s to the end of the century, the insane made up half of the patient roster at Pennsylvania Hospital. Similarly, in 1773, Virginia's first hospital opened solely for, quote, those miserable objects who could not help themselves, end quote. On October 12, 1773, the first asylum in the United States opened its doors. Located in Williamsburg, Virginia, the public hospital had been chartered 3 years prior, using land bequeathed by the House of Virginia's Legislative Assembly. By its own admission, the hospital was established for the support and maintenance of, quote, idiots, lunatics, and other persons of unsound minds, end quote, who threaten society. Realistically, there was little support for these, labeled as unfortunates in their society. Before the establishment of the hospital, insane individuals were judged by a jury, not a doctor. They were classified as criminals and lunatics and idiots. They were regarded as collateral damage in a quest for colonial normalcy. Though the aim was supposedly normal for this time period, the practices were brutal by modern standards.
Within the institution, there were overall 24 cells. Note the word used here is a cell. This word is commonly used to refer to a prison. The rooms were similar in structure to those that held criminals of the worst kinds. The windows all around were barred. They would be given chamber pots, and there would be also iron rings attached to the wall in which the quote-unquote dangerous patients' wrists or legs were attached to restrain them. The cells were specifically designed to isolate and confine the patients. Standard treatments included bleeding, bullying, blistering cells, shock water treatment, strong drugs, and also use of plunge baths. Further into time, the establishment also expanded and created a couple of dungeon-like cells to handle especially raving or frenzied patients. Fences reaching the height of 10 feet tall were implemented into the exercise courts, as well keeping the patients completely enclosed. It is interesting that the building was referred to as a hospital when there is no evidence of any intentional care for the patients.
Although many disabled people had hospitals to stay in Pennsylvania in 1751 and Virginia in 1773, all during the Progressive Era, they were still isolated from others. So that had a great impact on them because they were still put away from our society and labeled. Furthermore, as we are now knowledgeable of the tough times people deemed as mentally ill, sick people, or those to have disorderly minds in the early 1700s, the impact towards a progressive change took place in the latter part of the era. The formation of retreats gave some mentally ill people an opportunity towards a second chance in our society.